All right, y'all. Good evening. We are back. It is yours truly, Dr. Pierre, back from I think a well-deserved. I feel like it's well-deserved. A well-deserved content break. If you follow me on any of my other social media platforms, whether it be YouTube, the podcasts, obviously on TikTok, we ain't do nothing. Like we observed. We won't sit here and tell you that we weren't observing the social media, because what always happens, and I don't know why that always happens, that whenever, I go, again, I'm being narcissistic, whenever I say, oh, I ain't gonna really do nothing this week. I'm just gonna chill, just enjoy the news, not necessarily enjoy, but just take in the news. Everything happened. Everything happened. Obviously we heard about Bronny James. We heard about, Mitch McConnell did his little freeze thing again. It always happens when but we're back, right? And I figured there's no better way, right, to come back than to talk about COVID, which is always a very popular topic here on this social media platform, especially with, again, even this week, right? Even this week, as I go away, the other side is scaring people to think that we might be locking down again. Again, it always happens. It's like clockwork. It happens through and through every time we get down here. So tonight we're going to be talking about just what's going on with COVID right now. Obviously, we're hoping to dispel any wild rumors that you guys may have seen, read, or heard coming from, various, creators and blogs and YouTube channels and whatever. We're hoping to be able to get all of those out of there. I forgot. It's blocking my... let me see if I can turn my filter off, because I totally forgot I had my filter on, y'all. And when I got my filter, y'all can't say stuff like COVID and stuff like that. Let me see if I can take some of that stuff out. No. I got that filter off. Oh. So for those who don't know, especially if you don't go live, if you go live a lot, there's some filters, there's some words that you can put to making sure it don't come down, right? So someone might have said something like, I have Biden on here, vax, obviously a couple of, racial words on there, some curse words on there. So someone must have been saying that. I apologize if you were saying that, but we ain't talking about that tonight. Let's talk about some COVID. So right now, we know cases are rising. So if this is your first time seeing me across your live feed, or you don't follow me or not, we talked about this a few weeks ago, that this is when COVID starts doing what COVID does. Why? Because COVID has done this the last 3 years, right? Every year around this time frame, COVID numbers go up, hospitalizations go up. In fact, I was looking at the CDC. Let's look at the CDC real quick, just so we can get this week, as I record this, hospitalizations are up 20% from last week. I'm sorry, 18.8%, because I don't want to get on me, from last week. And COVID-related deaths are up 17% from last week. And that number just has continued to rise. If I would have came to you about a month ago, it was like 5 to 10% on hospitalizations, and in fact, it was like a 0% change in deaths from week to week. That was just a month ago. So yes, COVID numbers are here. I think you're starting to see more and more people, even though they try to not acknowledge it, you're seeing more and more people acknowledge, COVID's coming around. More and more people are getting sick from COVID. And again, it's just those two-step process, right? Not only are they getting sick, but they end up being hospitalized from the COVID, right? That's always that step. And then that last step, which we don't want, is that they're dying from the COVID. So this is when the numbers go, right? Now, from a percentage, because obviously stats and everything, percentage-wise, yes, the cases are going up. Yes, the cases are going up. Yes, the hospitalizations are going up. If we had to compare from this year to last year, is the total number of cases higher this year than last year? No. Now, and that's a good thing. I would hope people would understand that that's a good thing, that the total number of cases aren't as high. But it's the rate of cases. And we've always been afraid about the rate of cases. But fortunately, I guess for now, we'll knock on wood, the total number of cases are not up, but the percentages are, especially when comparison to week past. So yes, we are definitely dealing with our COVID flare. Just like when we talk about cold and flu season, COVID season is still here. Summertime, COVID goes up. Wintertime, COVID just goes up. So obviously kids are getting back into school. So I know that fear, I know that concern. And more importantly, the way you know it's getting serious is that now these healthcare settings, right, which I have always been a proponent of, like, y'all should have stayed masked up, is going back to masking. So the healthcare settings, the one that are, at the highest risk of having the sickest patients, are saying, hey, you know what? We need to go back to wearing masks. Now, again, you asked me, we should have never stopped wearing masks. But again, we're not here for that. We're not gonna Monday morning quarterback their decisions. They just did what they had to do. Right? They felt we were moving in the right direction, felt we didn't need the mask, so everyone took the mask off. And of course, now when you see these numbers go up, the first facilities that are going back to mask are the healthcare facilities, which I commend. Now, what we've seen, and it was wild to see. There was rumors, and I'm not even sure. I stopped checking to see which one of these, anti-vax, anti-COVID, anti-COVID folks like started this stuff. But apparently there was rumors that they were going to start a lockdown again. Let me tell you this. This country here, United States of America, or at least where I'm going live at, is never going to lock down again, especially due to COVID. Especially due to a COVID. Now, again, there may be some other disease that pop its head up next year, and that's, again, obviously we're knocking on wood. We're praying that don't happen. But when it talks about COVID, that's not going to happen. Why? And it's the reason why is kind of when we think about why we're having less total number of cases and total number of deaths in comparison, well, it's the fact that, hey, home tests are still available, even though obviously they're not free anymore. And this was something that I warned a lot of people once the federal emergency statutes kind of went away, that those same tests that you could just walk into Walgreens, CVS, grab and keep it moving, you were going to have to pay for. Now that there's COVID tests obviously still there, home tests are still there, treatment to try to avoid getting into the hospital is available. Obviously, you know me, vaccines are still available. So now that these things are available, we have a much better shot at protecting ourselves from the COVID numbers causing too much of a problem. So we do have those barriers, and that's a good thing. That is a good thing. I don't want us to be in a position that our pants are down our legs because we're not prepared for COVID. Like, that's not the case. We got vaccines, we got boosters, we got home test treatments, we have oral treatments that can prevent mild cases. So we have that, right? That's fortunate for us. So of course, when you hear these people try to fearmonger and scare you, say, "Oh my God, the vax folks are trying to lock us down again." That again is just one of those anti-vax rhetorics that tries to scare us. Fortunately, we pay them no mind. Like, we are, again, I want you guys to follow. Again, you don't have to follow me, right? But there are a lot of content creators on here, some amazing content creators on TikTok, on YouTube, Facebook, Clubhouse, wherever, right, that will make sure that you are educated in the right way. They're going to make sure you are going to, not scream from the rooftop because you heard some terrible rumor about us locking down. Now, of course, now you see the title as U.S. hospitalizations rise. Some places are bringing back mask mandates. Now that I'm behind. And again, I'm in a healthcare setting. I know I'm biased. I know I am biased. So I know that when I say, "Oh, just wear a mask," people are like, "Oh, well, you do that for work all day." Like, yes, I know that. But I'm for going back to wearing masks when you go to Publix. I'm in South Florida, so that's a grocery store down here, right? Grocery stores, right? I'm for when you're going out and about, especially, again, even if you're not thinking about yourself, right? Even if you don't care about yourself, the fact that you could possibly give it to someone who can't protect themselves, those are the people who I think we should be wearing masks for. Like, I'm not even thinking about the individual person anymore. I'm thinking about the person like, hey, let's protect the people who can't get vaccinated for lots of different reasons. Let's protect the people who, can't get the vaccines for lots of different reasons. Like, let's protect them, right? Like, there's a lot of people in that population that we should be looking out for. So even if you say I'm not wearing a mask because I don't think COVID is real, there's other people who do believe COVID is real because, they live in reality, who would definitely be beneficial, who would definitely benefit off you by wearing your mask. All right, so I'm 100% for that. So let's get to questions. Let's get to questions. I saw a couple of questions. Do I recommend getting the booster? Indeed. Like whenever the new booster comes around, I'm going to be there. It's extremely important. And again, a lot of the cases that we're seeing, especially with these new rise in hospitalizations, new rise in deaths, guess the people who are being affected. The people who are being affected, majority of them, about 60 to 70% of the people, are people over 65. So again, our elderly people who were able to get through the more significant waves of COVID, who got vaccinated, who were able to get boosted, are succumbing to these diseases. Why? Because again, they're the sickest, right? They're the weakest links per se, right? In terms of immunity. So again, 70% of the people who are being hospitalized, 65 and older, vaccinated or not, like, we should be looking out for them. Like, that makes common sense to me. Like, we should be looking out for them in regards to trying to protect them, because they're the ones ending up in the hospital. And this reminds me of when we talk about the flu, and especially those of younger age who recognize that, hey, if I get the flu, I might be down for a couple of days, but I'll bounce back. They never think about, hey, grandma not going to really bounce back like that. Grandpa can't really bounce back like that. My little brother and sister can't really bounce back like that. They never really think about the others. So we're seeing this kind of play over again in regards to COVID. They're like, hey, I'm good. Like, I'm young. I could deal with it. But not thinking about the ones, especially on the ends of the spectrum, especially from an age perspective, especially from a health perspective, who necessarily cannot. So let's look here. Let's get some questions. Yeah, y'all are live tonight. Like I say, I know y'all love talking COVID on here. It's always, some say, to be honest, we need lockdown. Now again, Mac, I don't know if I'm pronouncing that correctly. It says, to be honest, we need lockdown. Again, theoretically, right? Theoretically speaking, yeah, sure. Right. And again, is it an extended lockdown? But we just, obviously we operate in reality. This country, I'm in the state of Florida, y'all. This country is not locking down nothing no more. They lost way too much money to be even thinking about locking down. So they locked down. And again, and I'm on the side of, hey, you know what? When we locked down, we didn't have vaccines. We didn't have the ability to get home tests so people could test at home, say, hey, you got COVID at home, we didn't have that ability to readily fight against this disease. We have that ability now. So again, I can see scientifically why they wouldn't want to lock down. Because, hey, Barry, why you want to lock down? We got vaccines, we got boosters, right? We got oral medications if they have mild disease, right? We can send them home tests so they can test at home away from everybody. We have recommendations if they get sick, stay home for 5 to 10 days. We got those things. Why do I need to lock this thing down? So I can understand it. I can understand the practicality of not wanting to lock down, but I can tell you financially that ain't never going to happen. Someone said it's a struggle to request my family mask up again. Yeah, no, and this Penny just drops a great point. And again, once people got used to not, because remember, we obviously in this country we didn't wear masks before. We weren't the mask wearing type of country. So when we were forced to wear the mask and lockdown and everything else, people kind of got used to it. But once those mandates went away, people are like, oh, thank you, I'm back to normal. So people are just like, hey, I'm back to normal. I'm not wearing a mask. I'm cool on that mask game. So it is tough, right? Because now sometimes, especially, especially if you do travel or anything else, and if you look around and you're like, oh, I'm like probably one of the few people when I look who actually still has their mask on. So it becomes even more evident because less and less people are doing it versus, other parts of the world where they're always wearing a mask. So you actually more stand out when you're not wearing a mask. So over here, it's just different. But appreciate you for continuing to wear your mask to protect yourself and others. Let's see here. And Amy says she has COVID. So does her two daughters. And yeah, this variant, and the variant that we mentioned, I talked about this on my YouTube channel. Make sure you subscribe to the YouTube channel. Make sure you follow and subscribe. The EG5 right now. And I know, first of all, let me preface this, right? I know, especially those on the anti-vax side, whenever we talk about COVID, seem to have the worst level of distrust for the CDC. But the second the CDC says, hey, stop eating salad from Chipotle, they want to boycott Chipotle left and right. So they pick and choose when CDC is like a authority in health. But the CDC keeps track of these variants right here. And there's a site, in fact, because I record this recording on our YouTube channel, it'll be up tomorrow. I'll put a link to the CDC's tracker, and you can see looks like 2 months ago. Yeah, about 2 months ago, and it gives a nice little bar chart of what it looked like for the EG5, right, which is this variant that was just kind of bubbling versus how much it's grown. So the EG5 or ERIS has accounted for up to about 20% of new cases of COVID. It's likely responsible for this surge on top of the other variants, but it's a big part of this surge that's occurring now. And from a severity standpoint, which at least, again, we're knocking on wood, severity wise, we're not seeing worse severity. Like it's not as severe, AKA like the Delta. And people who like, what does it mean by Delta? Like, if you don't like, it's okay, right? It's just especially those in the healthcare field, when we think about COVID and we think about these COVID, upticks, like I can attach them to certain variants. So like one of the most deadliest variant that we encountered was the Delta variant. Now, it didn't have the sheer number of cases like Omicron did, but it was so deadly as far as just people who are dying from it. So fortunately, even with this variant EG5, it's not as severe, but it does have ways to kind of maneuver, even if you've gotten vaccinated and boosted. And for a lot of people, you probably haven't been vaccinated for almost like a year or so. And so that's why new boosters are on the way to try to catch back up, just to make sure we get a handle on this. So definitely we are going to send all of our thoughts and health prayers for Naomi and her family and anyone who's gotten COVID, recently, or any of their family members have gotten it. And yeah, she said that it started as a sinus infection. Oh yeah, it's so funny. So funny the amount of patients who I'm diagnosing now, especially in the rehab center, because I did a video a couple weeks ago where we talked about some of the symptoms. Like some of the symptoms were like, I got a head cold, I got a sore throat, I got this and I got that. And I'm like, oh, you know what? Go check them for COVID, right? Like before we were like, oh, if you're short of breath, you're this, you're that, your fever's, now you're checking for COVID. Now, if you got even cold-like symptoms, I'm going to make sure you don't have COVID because of the way it's kind of presenting. So it is presenting differently in a few people from that standpoint there. Starting to hit the schools. Yeah, and again, we would expect it to hit the schools because this is, obviously the kids are back, right? And kids definitely aren't masking, right? They weren't really masking, but the kids definitely aren't masking. And when we think about just the percentage of kids who got the boosters, right, that's even lower, right? So which means that even if they got vaccinated, from the OG vaccination, those who got the boosters are even less, right? Which means it's been even further away, right? Since they gotten, any type of additional protections, which is why you're seeing more of these cases kind of pick up than the other. Some says spreading fear helps. Yeah, that's funny. Someone asked me what we're trying to scare people. CDC drink the Kool-Aid. Yeah, like I said, we love our anti-vaxxers, right? Because they can't help but to show themselves from the standpoint there. Let's someone says not the flu. Yeah, whenever you see people say such BS, it's the flu. One that lets you know that they're not very educated. It just lets you know they're not very educated whenever you see someone try to compare COVID and the flu. Because if you just looked at a sheer numbers game on the number of cases of people who've gotten COVID in the past 3 years versus the number of cases of people who've gotten the flu in the past 20, right? If you just compare those numbers, you'd be like, oh yeah, this is definitely not the same. If we did the same thing with deaths in the past 3 years versus deaths in the past 20 for the flu, again, we would know very, very quickly it's not the same. So whenever you see people say it, we just don't pay no mind. When will the boosters be available? So they're looking like late fall is what most of the articles are going after. Even though I think I saw Moderna's trying to push theirs up a little bit early because, try to get their money. I ain't mad at them. But look at like late fall is when they'll have boosters available. What's that? Someone said my county's up 36%, even with no mandated reporting. Have 5 cases in clinic today. Yeah, no, it's tough, right? I think that's the tough thing, right? Appreciate the rose, appreciate the hearts. That's like the numbers are there, right? Like people who were flat out denying, and they do this every time. When COVID numbers are flat, they start telling you, like I told y'all was over exaggerating everything. And the second COVID numbers run back up, they got no choice but to say, okay, all right, like I was listening to the Joe Budden podcast, very fun podcast, but unfortunately, like a couple of them, you could tell one's definitely anti-vax, right? One's definitely anti-vax, and the rest of them got vaccinated, but I think the anti-vaxxer has like poisoned their mind now, so now they're very skeptical of the vaccine, which is hilarious, right? Because it's just irony. So even now, they're having to say like, hey, COVID's back, y'all. COVID is back, right? Because they see the numbers, right? Because again, you'd have to be blind not to see the numbers. So it's just one of those things where until it's right in your face, you will deny. That's what the anti-vaxxers do. Even though we show them the numbers, show them the data, they're just going to keep denying. So that's why we don't really talk to them. We don't really talk to them because they're not actually looking for an education. They're looking for an argument. And, there's a lot more people who want to be educated on the newest booster, the newest variant. There's a lot of people who want to be educated, so you don't necessarily have to argue with people who necessarily don't from this standpoint. Well, let's see here. Yep, I'm seeing a lot of people saying they just recently got COVID. We'll highlight Mr. Chantel, then we'll block. Chantel said this is just BS. He's the same person who said COVID, flu, same thing. This is just a way for Big Pharma to make money. Don't drink the Kool-Aid, right? So again, when you have people like this who you can tell them like, hey, 18% rise in hospitalizations from last week, 18% rise in deaths from last week. They hear those numbers. They hear it. They watch TV too, just like I watch TV. They watch it, so they see everyone saying like, hey, and then they want to tell you that this is some big plot for Big Pharma, right? The boogeyman, Big Pharma, right, to make all of this money, right? It's always this scrupulous big plot that only they seem to know. Like everyone else is oblivious to Big Pharma's game plan except them, right? Oh, it's always the funniest. Let's see here. Let's see. We'll go to the next one. Hey, Airman. We seen you plenty. Said, yeah, it causes so much anxiety. Yeah, no, I think that's what's so tough about. when the variant starts doing the rise, because again, just like clockwork, variants go up, cases go up, hospitalizations go up. All of a sudden, now the news puts the camera back on COVID, because for a while, especially after the emergency authorization went away and everything else, and the money went away, the news cameras kind of went away and said all right, we're going to not really focus on COVID right now. But of course, now that from a media standpoint, it makes financial sense to talk about COVID again. Now everyone's kind of talking about COVID, which again kind of drives the anxiety up, right? So, and it's again, stay strong, right? We've been here. Right, this is again, we're year 3 coming around. We've been through this wave. We understand what's happening now. We know how to protect ourselves, and we are better equipped at protecting ourselves. Right, we can get vaccinated, we can get boosted, we can wear masks, we can stay away from people as much as possible. Right, I know people work, people do. I know life happens. Right, but we can protect ourselves as much as we can. So knowing that, that should kind of try to but it's not going to zero it out. But understand that we do have a lot more weapons at our disposal to protect people, right? So shout out to that. Oh, shout out for the lightning bolts. Much appreciated here. And I want to highlight this because this is actually a good point. Roscoe says COVID is up, but the flu just disappeared. So right now we're not necessarily in cold and flu season, so that's why you're not seeing flu cases rise. But one of the things that happened, especially when COVID first came around, is that because COVID spread so quickly in comparison to flu, which is why there's no point in comparing to flu, because it spread so quickly in comparison to flu and can spread to more people in comparison to the flu. Like I have one of my good followers, Neighborhood Virologist. You should search him on TikTok and follow him. He talks about this, there's a number, right? Again, we're not going to scientific this thing out, but he talks about the fact that if you have COVID, you have the ability to maybe infect, let's say 8 people. We'll just make it easy numbers. But if you have the flu, you may only be able to infect 1 or 2 people. So when you think about the fact that 4 times more people will get infected by COVID if I'm sick and I give everybody COVID versus just the one person, then you can kind of understand just how it spreads so quickly and just how more people will be like, oh, everyone has a COVID. What happens to the flu? So, and that's what exactly happened where like that occurred, right? And then another thing that happened, because we are wearing the especially most people are wearing like the cloth mask. The cloth mask does a very good job at kind of stopping and slowing. Not let me say slowing, because I already know how the anti-vaxxers do, right? Because they want to like hop on one word and they'll ride that one word for like 2 years, right? Slowing the spread down with the cloth mask does a better job with the flu than does COVID. So less people got the flu because everyone was wearing masks up as well too. So that's why you're seeing that combination of COVID cases rising and nobody really talking about the flu. But when cold and flu season come up, which is again about 2 months, you'll see the talk happen for the flu again. Let's see here. Someone said, yep, they're working in places they don't even, no, it's tough. It is tough. Everybody said lock it down. We can't lock it down. Trust me, they won't let us. They will not let us, even if they tried. Yes, Jay said a couple schools were closed in South Texas. Oh yeah, I saw that. Oh, my glasses always do this whenever I go live. I saw that people were talking about, like I saw a couple of schools in Texas. Say, hey, you know what? We got to slow this thing down. Because the cases are running up the score. And again, it's one of those things where the biggest issue with COVID obviously was the amount of people who can get it. And, the deaths because of the amount of people who can get it, which means you have more people who could die from it. But the fact that it spread so quickly that it can overwhelm a small town very quickly. Very quickly. So again, you see 20%, 18% cases rise in the past week. Again, we have the capacity to deal with it, but there may be some towns that can't deal with an 18% increase in cases. There's some towns that cannot deal with an 18% increases in cases in one whole week. And knowing that the following week, those more cases are going to pile up. So a lot of times to slow it down, again, you're not necessarily locking down. You're saying, hey, everyone don't come here. And that's our way of social distancing and keeping people away long enough for like this current wave to kind of slow down and then to bring the kids back, which is likely the scenario that's going to be happening with the school over there in Texas. Let's see. So Emerald, this is a great question, right? So Emerald asks if my area is considered low, should I be concerned? So, and this is an issue that we kind of discussed probably like a year or so ago, because what happened is that the CDC has reclassified what is a hot area, medium area, low risk area. And what happens is they change their equation, which, whatever, right? But they changed their equation, and a lot of their equation was based on how many people tested positive and then end up in the hospital. So of course, when you had, the hospitalizations low, that was a good thing for you. But now that you're seeing these rise in hospital cases, now you're seeing these rise in areas that used to be low, be medium, or medium and be high. So when you say an area is low, they're more looking at the fact that, hey, based on the burden of people there, our hospitals can handle everyone who's got COVID. So it's not to say that like everyone's not getting COVID. It's just that those who are getting COVID aren't ending up hospitalized and aren't overwhelming the area that you reside in, which typically happens in a lot of, obviously, if you live in a city where you have more people, more hospitals, right, you can absorb more versus a small town in Texas that really can't absorb that amount of people getting sick at the same time. Okay. Someone said we should be locking up those responsible. We can't lock nobody up, bro. We can't lock nobody up. Oh, natural immunity. Oh, man. You know, so we've been talking about COVID for so long that I gotta look, because I got a great video for this as well too. But like, this is the example I give when people talk about natural immunity, right? One, I don't know what that means. I don't really know what natural immunity means, right? But let's give the example, right? I always give the example of HIV, right? Like, if I told you, right, hey, you know what? Person has HIV, you probably don't have unprotected sex with them, right? You say natural immunity is king. What you're saying is that, no. I can get that virus and my body's own natural reaction is going to be able to fight that virus. We all know that is not the case, right? We all know that is not the case. But for some reason, when we talk about COVID, a lot of people were like, no. I'm okay getting COVID. Like, I'll deal with the COVID because, I eat sea moss and whatever, right? And no sly at the sea moss folks. But like, they say, oh, my body is good enough that I can fight against the COVID if I get attacked. Why would you? And I always ask, why do you want the disease? You shouldn't want the disease and hope that your body is strong enough to fight against said disease. That's not the type of prevention we like to encounter, right? Like, the goal is to try to not get it at all, right? And try to find any way to prevent you from getting it at all. Not say, hey, body, get the disease because we're strong enough, and then you'll deal with it because you got natural immunity and, you eat, your sea moss and your magnesium and whatever natural immunity. Like, so yeah, no, we never go with natural immunity. We want to prevent. We don't want you guys to get it and have to fight it off. Especially because, again, just do a search. Just do a search right now, get off the live and do a search for long COVID. There's a lot of people here who got COVID who are still here, and 1 year, 2 year, sometimes 3 years later are still dealing with the effects of COVID. That's their natural immunity was there. That's what the natural immunity said. Hey, I'm going to fight COVID long enough so you can stay alive. But guess what? Now you have to deal with every other thing and every issue associated with it. Like, hey, like, I kept you alive. Natural immunity, I kept you there. Right? So that's why I try to, like, get people away from natural immunity, because one, like, let's just protect ourselves from getting it completely. Like, let's do what we can there, and then hope that our body is strong enough if we happen to get it to fight it off and not deal with any of the sequelae that occurs after COVID is gone. Because again, just search long COVID. There's a lot of people here who still have to deal with COVID to this day, right? Still are living with the effects of COVID to this day, even though they weren't one of those people who unfortunately died from COVID. Right? It's extremely tough. Are they still paying hospitals money for positive tests? Oh, that's a good question. This was a big anti-vax thing too, right? Because they always felt that, and I'm not, again, it was funny that hospitals were being incentivized to, diagnose patients with COVID for extra money, or incentivized to have patients who die from COVID. Like, for some reason, like, there was this anti-vaxxer thought that, like, hospitals were actually making money if you either got hospitalized for or death. Let me show you. Hospitals make money the second you touch the building. The second you touch the building with a cold, right, and you get admitted, hospitals make money. When you get a heart attack, hospitals make money. When you got pneumonia, hospitals make money. When you break a bone and the surgeon has to fix you, hospitals make money. So I'm not sure why they think that COVID is in this illustrious category that the hospitals could be making money. Now, are hospitals making extra money because you happen to be COVID positive? No. Right. I can assure you, hospitals don't want you to come to the hospital, right? If you have COVID, they don't want to say, oh, let's get all the COVID. They don't want that, right? They don't want sick people, They don't want sick people, right? And they don't get incentivized for it. What I think got misconstrued, especially from a lot of anti-vaxxers, is that because COVID was such a new disease, like there wasn't a way to like, hey, they're like, what is this disease here? So the federal government saying, hey, you know what? Because this is a new disease that we're all learning together, even if the patient is insured or more importantly, uninsured, we will help cover your costs. So when you see people try to say, are the hospitals making money from COVID? What they're saying is that, hey, I know those uninsured patients, right, that couldn't get any costs. The government was paying for them. We should look at that because that's a bad thing. No, it was only strictly an issue of, hey, if you are uninsured, you get COVID, you don't have to worry, right? Because the government's going to pay for your bills, right? Like that was the issue at hand. It was never this, maniacal thing of like, hey, let's get everyone here, and let's, even if they come in with a broken bone, we're gonna say they have COVID just so we can get extra money, right? It was, I just couldn't. I've never understood why y'all get that. Like, just very weird to me. All right, yes, mask up again. Hospitals always make bank. I don't know what. I can assure you. In fact, and we'll just do a quick financial lesson, right? From a hospital standpoint, a hospital makes more money if you go to the hospital for a broken hip than you get for getting pneumonia, right? From anything, but we'll include COVID. Broken hip, pneumonia. They want the broken hip. Guess what was happening when COVID was doing COVID thing? They stopped all of the elective surgeries. So the surgeries or the procedures that the hospital was really making bank on, they stopped, right? Because they had to take care of all of the pneumonia patients. So again, if you ask a hospital, would you rather deal with the broken hips or the COVID pneumonias? They're going to tell you the broken hips 10 times out of 10. Right. So no, I can assure you the hospitals weren't being greedy and trying to diagnose everyone with COVID just so they can get a little bit extra money. Like, no, they'd rather have the broken hip. Again, obviously, I know y'all not really here for like, business and hospital stuff, but like this is how like us content creators, when we hear the stuff from the anti-vaxxers, that is how we be processing. Like, you can tell these folks don't know nothing. They don't know nothing. So they want to blame everything else, right? Because again, they have this distrust of government, distrust of big pharma, distrust of health. They don't trust. I don't know who y'all trust, honestly. But like I said, if the CDC told y'all stop eating salads right now from Chipotle, y'all wouldn't touch a salad, right? So it just picks and choose like when the CDC is someone y'all want to follow. And that's why we don't really pay y'all no mind. Let's see here. COVID money. Everyone was getting COVID money. Hospitals did get more money during COVID. No, they didn't get more money. They just got paid for COVID. And there was no incentives, right? And again, the whole incentive is about deaths because, again, I'm a hospital physician. So I was the one who had to fill out the death certificates. There was no checks being written, right? Because I said, hey, you know what? I'm gonna write COVID for you, so send that check. Like, because I don't know who would be paying the check. Like, I don't. It just never knew anything. Let's see here. We got people thinking that this is an election related reason. And again, this is just one of those things where, from an education standpoint. So if I told you that for the past 3 years since COVID, during July, August, September, COVID cases go up, right? Then it wouldn't make no sense for you to think that the election is why the COVID cases are going up. No, this is when they go up. This is because if you just look at the numbers, again, I follow your own sources, but if you just look at the numbers, COVID cases typically go up, July, August, September, because they've done that for the past 3 years every single time, especially with school and everything else. From that standpoint, someone said, "Why the hospitals charge 20 for a bottle when you can get that same?" Now that's a whole nother. See, this is Justin says, "Why do hospitals charge 20 for a bottle of Advil when I can get the same in pharmacy?" That's a whole nother discussion. As far as just hospitals like supercharging you, but they do that. But like I said, they were doing that before COVID, and it's the reasons why like your hospitals will charge that, but when they send that bill to Humana or Cigna or Aetna. Aetna be like, hey, yeah, I'm cool with you. I see you gonna charge me 20 for that Advil. I'm not paying that, right? So it's just one of those things where like they upcharge like crazy because insurance companies, again, like I said, I know y'all not here for this, but insurance companies will be like, yeah, that's cool that you want to send us a bill for 10,000. Here's 1,500, right? So that's typically why you see these huge crazy bills, right? Because they know that the insurance company is going to chop all that down when the final bill gets to them. Which is why when I talk to my uninsured patients, I tell them, hey, first of all, get taken care of right now, right? Get taken care of right now. And then when they send you that bill, you go talk to the financial office and say, hey, I want an itemized bill. Right. And I want you to tell me why you about to charge me $20 for this Advil, and they'll mark it down quick, fast, in a hurry. Right. But that's my talk for the my unvaccinated folks in that regards. Let's see here. Yep. Someone said I started masking up again. I appreciate that. Appreciate you, Kaylin. Kaylin said, thank you for spreading accurate information. We need more of this. Almost definitely. Yeah, like I said, and I'm just one of many, right? One of my favorite content creators on here, neighborhood virologist, Dr. Rubin, Laughter and Light. There's a few others, right, who just like they fight the good fight, really educating as much as they can to try to get you as the most factual information, because that's what's really important here. Dr. Eric is another one. He's very funny. He's very funny. He's definitely another person you should follow as well too. Yep. Shout out to the COVID. Yep. I see my N95 mask going. Someone said, where did monkeypox go? Monkeypox is still here. It's just one of those things where, again, when we talk about media, when we talk about healthcare, right now the camera is off of monkeypox. Now, again, people are still getting monkeypox cases. Are they at the rate that we were getting them when monkeypox first touched down? No. But people are still getting it. Like there was an outbreak, I think like a month or so ago, I think in like Illinois or Indiana area. It's still there. It's just, it's one, again, we got vaccines for it. And two, people are wiping down like crazy. Like if you go to a gym right now, I know for a fact the gyms got to be going through 100% more of that detergent or whatever cleaning solution that they use than they used to before, because everyone wiped down everything. Like before you go in the gym, people are like sometimes wipe, sometimes want to wipe. Nah, they wiping before, they wiping after. Especially because monkeypox, you can physically see some issues versus what you can't do for whatchamacallit. Oh, we got more people telling us about how we code. Standpoint there, election distraction. Yeah, too funny. Let's see here. The anti-vaxxers are funny. I'm seeing a couple people saying that this is the election variant. That's a good one. The election variant. Someone asked thoughts on the nasal spray. Yeah, so again, right now, obviously from a boosting perspective, a protection standpoint, obviously you have vaccines. And there's some people who don't want to get who don't want to, get an injection. So now there are definitely working on different formularies to try to, get the medication in your system to try to prevent it. Nasal has always been one because, obviously we know we have a flu nasal spray as well that can kind of help assist with that. So it's just going to be another option. I doubt you'll see like head to head, like nasal versus like injectable. But it'll just be, once it goes down, it'll be another option for people who want to be protected one way, shape or form. Not one person said that masks don't work and give source. Yeah, someone said now one person says masks don't work and give a source explanation as to why. Yeah, no, because that's the thing. When you hear, especially from anti-vaxxers, right, they speak in such absolutes that if the mask right? Don't, especially, and I'm assuming they're talking about the cloth mask. If the mask don't 100% protect you, right, from either getting COVID, spreading COVID, decrease, like if it don't 100% protect you from that, they say it don't work. They say for them, they'd rather throw it all away, right? They'd rather throw it away. Oh, if it don't 100% protect me, throw it all away. Right. Again, like for example, like if you had a condom, right? Does a condom 100% protect you from, getting an STD, getting pregnant, or anything? No, it don't 100% protect you, but it does a very good job, right? But in their eyes, since it don't 100% protect you from doing it, it don't work at all. Right, like that's how they operate in regards to that's the standard that they operate when we talk about masks. So whenever you hear someone say masks don't work, that's the standard that they're operating at. Like, oh, if it don't 100% protect me from getting this, it does not work. Get that thing out of here. And so again, those are people you're just like, okay, no, those are people we don't pay any mind to. So it said there will be a new booster coming into the fall. New booster will be here in the fall. From that standpoint, let's see here. I'm gonna have to make that community works better. Say peace with AIDS and Hep C. Yeah. Like no, that's what's so funny, right? Again, I say if natural immunity works better, get HIV. Right, get HIV. Let me know how your body works for you. And of course, they usually don't have an answer for that. Hospitals have instituted shadow beds. Y'all are too funny. Y'all are too. We gotta, like I said, I like to highlight them because when one person says something like this, there's a gang of people behind them who actually believe it. This person believes that hospitals have shadow beds, right? To say, hey, just say beds 2 through 5 have COVID, so they can bill somebody, I'm assuming the government, later, right, for it, right? Like that is what's happening here. Or it's a weird thing. It's a weird thing to me when you think about, this aspect of the lengths that they think hospitals will go to try to make money, right, on behalf of COVID. But again, whatever. What can you do? Let's see here. So someone says, ignore Fauci. Oh, they brought up Fauci. Oh, I haven't heard that name in a while. Y'all haven't. I'm so glad when Fauci retired, because then y'all didn't have a person. Because I know Fauci for the anti-vaxxers. Fauci used to be y'all like big joker. Like y'all used to love y'all talked about Fauci more than I've ever heard talk about Fauci. Right? And mind you, I'm an internal medicine physician. And for those who don't know, in internal medicine, we have this book called Harrison, which is kind of like our internal medicine like Bible, right? And again, obviously we don't know, but like that's how it is. And guess who is one of the main editors of the Internal Medicine Bible, who's been that for like a decade plus? Fauci, right? Like this guy is on such a different level when it comes to clinicians and physicians, but like the general public will have y'all thinking that Fauci is some like, plant from the government who don't really know nothing, who lies. Like that's what, the general public, and of course that one administration with the indicted president, former president, and, currently double indicted, double impeached, whatever, right? Like that guy. He had y'all thinking that Fauci was just like this regular physician, but when us on this side know that Fauci is like that guy. Like, and he's been that guy for a very long time, right? But I'm glad he retired, so y'all don't have to, talk about him as much as y'all do. Someone says my husband is an active duty military. They're mandatory mask again. Oh yeah, and one thing about the military don't never play that, right? When it came to when the vaccines were available, the military said, "Hey, get vaccinated or get out." And I saw there was a lot of fake uproar about it, but a lot of people got vaccinated, right? Because at the end of the day, you are going to get vaccinated just like you got vaccinated for, typhoid and all these other things that you get vaccinated for. But a lot of those anti-vaxxers who were in the military were making all these like stupid TikToks, like they weren't going to get like, oh, I'm going to make a stand and not get vaccinated. And military told them get vaccinated or get out. And a lot of people like tighten up because that's what you do in the military. Yeah, the military does not play that in the because again, remember, like imagine, right? If you're in the military, you're in a base, right? And you got one person who has the ability to affect the whole base, right? Because they spread to 8 people, those 8 people spread to 64. Like imagine that, right? So yeah, no, the military does not play that for sure. Let's see here. Oh, this is too funny. Yeah, no, this will be so. Yeah, so let me see. Issues, heart issues. No, they're not. Whenever I see people say like weird statements, I would just on my channel we say sources. We're a big aspect of sources, like like bring your sources out when you say stuff like there's an increased rise in heart cases, increased rise in this, increased rise in that, right? Like it's too wild. That's too funny, right? All right. Let's see here. All right. So it looks like we don't have too much, just more anti-vaxxer talk, right? So again, I appreciate y'all. Like I said, we do this every Thursday evenings, usually about 9 p.m. Eastern Standard Time. I know whenever we talk about COVID, it becomes very lively. It becomes a lot of, and I apologize for those who are watching, right? Especially because typically my comments, and mind you, like these are nothing, right? Like my regular videos get filled with comments like this anyway. So I don't want y'all to be discouraged. Yes, cases are going up. Yes, hospitalizations are going up. So right now, the best way to protect yourself is, wear your mask. Get back to wearing your mask. Again, don't worry about the lockdown talk. That's not happening. We are not locking down. I can assure you, right? I don't want to promise you, but I can assure you we are not going to lock down. But we got to just protect ourselves, especially while this variant is doing what this variant is doing. So wear your mask. Try to avoid people as much as you can. If you start feeling ill, start feeling sick, even if it feels like a regular head cold, right? Get tested for COVID. Go to your local pharmacy if you can. Get tested for COVID because it is presenting differently than it's presented in the past. So you may not get the shortness of breath, fevers, or diarrhea. You may not get those things. You may just get like sore throat or some things like that. And then boom, now you got COVID, right? So y'all be blessed. Remember, we record this episode on our YouTube page. So it'll be on our YouTube page tomorrow. Like, follow, share, and I appreciate y'all. Y'all be blessed. Y'all have a great night.